computer as well.
Okay.
So my name is Dr.
welcome.
Halasa. I'm the founder of Chronic Disease Prevention and Management, and we're gonna talk about cyclodextrin. This is a CME from American Medical Association, Category 1, and so you can get I think the link. They send it to me. Let me just go ahead and, oh gosh, my phone. They send it in my phone, I think.
I'll put it in the chat later. You can start.
Oh, you have it? You have it?
Yeah, I will get it from Clearfield.
Did I give it to you? Well, Dr.
I
William
think
has
so.
it.
You sent me it yesterday. I'll put it in the chat.
Oh, that's not the one.
No? Okay, I'll
No,
ask
no,
Clearfield.
no. This is
Clearfield will text it to me. I'll
this
ask
is fresh just now. The yesterday one is it's for the yesterday. I have it here. Let me go ahead and put it in the chat. Where is the chat room here? Okay, so here's the link. Okay. Let me make sure this is the one. Let me see here.
Let's restart this.
Yeah, that's it. Yeah. So this is the one. So you go there and you click, and then you answer some questions, and you get your CME email to you. I think that's the part of the
okay.
CME. Now
we'll start. Now we'll start for real. Welcome.
Right. I'm recording currently, so okay, go ahead.
Welcome, everyone. Dr. Halasa is going to give us a presentation on the cyclodextrin today.
Right. Is my voice clear? Everything is good? Good. Okay. You can hear my voice, right? It's not muffled because I'm outside. And I want to make sure that... So yeah, today we're going to talk about clinical application of cyclodextrin. And it's a CME 2-hour from American Medical Association, Category 1. And so what is the beta-cyclodextrin? It is a fascinating molecule with a wide range of application in pharmaceutical and clinical industry, another clinical and pharmaceutical industry. And here's an expanded look at its clinical application. That's what we are going to talk about. But let's go and understand the chemistry behind the beta-cyclodextrin. It's a cyclic oligosaccharide. So basically, it's a polymer of sugar composed of alpha-1,4 link D glucopyranose units. And this structure forms a toroidal shape with hydrophilic outer surface and hydrophilic center cavity. So basically, outside is hydrophilic and inside is hydrophobic. And that's a good thing, because if you want to use it to collect fat-soluble toxins, chelation for fat-soluble toxins. And we know that we don't have any chelation for fat-soluble toxins like organophosphorus or those old fat petrochemicals and plastic and all those fat-soluble toxins that's being stored in the fat tissue.
The mold too,
especially during weight loss. You need to have something that will collect them, and then you can get rid from them through the liver. The liver will take it to the bile, and you get rid from it, or through the urine. But mostly they go through the bile. And so this is very good for detoxing fat-soluble toxins. And we don't have any chelation drug out there for fat-soluble toxins. I mean, zeolite, activated charcoal, they work for metals and heavy metals and water-soluble. But
yeah, but they're problematic because they bind to all the minerals, vitamins.
That's right. So this one works to detox the body from fat-soluble toxins. And also, here's the good news. It helps to detox the xenoestrogens. Remember, we have problem with that too in the meat, which causes estrogen dominant syndrome.
Yeah.
And causing infertility and polycystic ovarian syndrome. So this help in detoxing body from the xenoestrogens. And it helps to clear the body from extra cholesterol that's being deposited in your blood vessels. And that's also good news, right? Because we can use it for atherosclerosis.
Yes.
And the beauty above all of this is that this can be used to load the drugs and form nanoparticles with the drugs, and that will change its pharmacokinetic and pharmacodynamics, makes it more effective, more targeting, more stable, more dissolvent to the water, so the absorption and bioavailability is better. And the shield of this polymers protects the drugs, especially the peptides and possibly messenger RNAs, from being degraded by the enzymes of the body. So that's a good thing. And also, if you take it orally, it will resist the digestion of the acids and the gastric enzymes, and also intestinal enzymes and pancreatic enzymes. So that's good for when you are trying to take anything orally, especially peptides, and you want to protect them from the acidity or any drugs from being damaged, then you load them inside this polysaccharides. And the absorption mastids will go through the lymphatics. So that's also a good thing, bypassing the liver metabolism. There's many good things about loading drugs in cyclodextrin. And all the big pharma are moving to this direction. And compounding pharmacy does the same thing. And we encourage a lot of companies to do. Now, what about it's biodegradable? Yes, in the body, it's biodegradable. Most of it will be degraded into CO2 and water. A few of them will be excreted in the feces and the urine. And so it is biodegradable. That's a good thing. So it will not be stuck in the body. In 36 hours, it will be completely secreted from the body. So I'd like to say that all the supplements and drugs, we want them to be cyclodextrin based. So the unique structure of the beta-cyclodextrin allow it to form inclusion complex with various pharmaceutical agents, enhancing their solubility and stability. So that's a good thing, right? Enhancing drug solubility and stability, one of the primary applications of beta-cyclodextrin is to increase the solubility of poorly water-soluble drugs. So let's say if you want to create tablets of progesterone or estrogen, or progesterone especially, then you can use cyclodextrin for that. By forming non-covalent inclusion complex, they basically would you pack them inside this complex, because the inner is hydrophobic, so they will get in, and the outside is hydrophilic, so it will dissolve into the water. So this beta-cyclodextrin can encapsulate hydrophobic drugs like progesterone, for example, and also hydrophilic drugs, by the way. So you can use it to load it. You can load methylene blue in it, oxytocin in it, and any drug you want. But specifically, especially the ones that's not dissolved in the water, I mean, that's the problem we have. So this drug, this cyclodextrin will help in the absorption of hydrophobic drugs molecule within central cavity, effectively increasing their aqueous solubility and potentially their bioavailability. So yes, it will change their pharmacokinetics, and also will change the pharmacodynamics, because it will help to increase the targeting effect of the drug and the efficacy of the drug as well, especially if you have something like antibiotic that's resistance. For some reason, the bacteria is not allowing those antibiotics to go in. Through cyclodextrin complex with these antibiotics, it will get in through endocytosis, and it will kill the bacteria. So it does help to, if you have a problem with resistance, then you load them with cyclodextrin and you can break that resistance. The good thing when we are trying to, forming compounded formulations for drugs, some of them, they taste nasty and smell nasty, right? Like cysteine, for example, NAC, they smell like eggs. Using cyclodextrin will mask that smell and taste, which is a good thing for masking the flavor. In other words, the unpleasant taste and odor for the drug. The beta-cyclodextrin is also used to improve the sensory properties of the pharmaceutical by masking unpleasant taste and odor. And this can be particularly beneficial in pediatric and geriatric formulations, especially for the compounding pharmacies, where taste and odor can significantly impact the patient compliance. You know, the kids, they don't like to have something that's bitter or taste nasty or smell nasty. Clinical application of cyclodextrin. We know the cyclodextrin, it does help to protect the drugs from being degraded by the enzymes of your body. So it acts like a shield, especially if you're using peptide like GLP-1 or oxytocin, or you want to protect them from the enzyme, or you want to protect them from being degraded by acidic enzyme if you're taking orally those drugs. So inclusion of complex formation can also protect the active pharmaceutical ingredients from degradation. And this includes protection against the light, oxidation, microbial contamination, thereby extending the shelf life of the drugs. That's a good thing, right? Even inside the vial, those cyclodextrin will help to keep those drugs more stable, more longer, and protected if there's any bacteria in that vial. It will protect them from being degraded by the enzymes of the microbes or by the oxidation or against the light. Vitamin B12, it get degraded by the light. That's why they put inside a special glass of vials that prevent lights from entering. But complexing with cyclodextrin is a good idea as well. Clinical application, drug delivery system. So we know it will help to particulate the drugs into nano-sized, and it does help to increase the targeting efficacy, because cyclodextrin, with the nano size, it will leak more into the pathology versus oral. And also, you can use it for oral delivery, topical, even topical. It helps to push the drug through the skin. It protects the drug from being degraded from the gastric and from pancreatic enzymes. And also, you can use it for para-enteral formulations as well. So we can make complex, and especially those fat-soluble drugs who cannot be, those fat-soluble drugs, you can dissolve it in the water and protect it from degradation and target those drugs using cyclodextrin as a capsule. Enhance the topical penetration. So if you're having any drug that you want to pass through the skin, like sex hormones, testosterone, or estrogen, then we can complex it with cyclodextrin. It helps to push the drugs through the skin. It enhances the penetration of the skin, of the active ingredient through the skin. That's a good thing, right? And potentially improving the therapeutic outcome. So any topical application, lidocaine, sex hormones, whatever you're doing topical, you can enhance the absorption to the skin by using this base, cyclodextrin as a base for delivering the drug. And more importantly, and the best thing about the cyclodextrin, it helps to use for ophthalmic eye drops. And it's safe. So if you have a drug you want to pass it through, or you want to put it as eye drops, complexing with cyclodextrin would help to get the drug past and enter the eye and reach the target. And so it will improve the solubility there and ocular absorption of certain drugs. That's a good thing, right? And so I do recommend, using this, especially if you want to do eye drops from methylene blue or oxytocin or clotho. This will be a good way of doing it, using cyclodextrin. Or eye drop of losartan, for example, I will use cyclodextrin for that. So what is the clinical, what is the toxicology concentration? While beta-cyclodextrin has many benefits, important to consider its toxicology profile. Generally, the beta-cyclodextrin is considered safe, so that's a good thing, and non-toxic. I think up to 20 grams per day, it's okay. I don't go above 20 grams. However, the safety of its derivatives and the concentration used in formulation should always be evaluated. According to the company that I talked to, 20 milligram, 20 gram daily, that's the max you can do safely with this drug. So that's a very big quantity, 20 grams. So it's very safe and it's biodegradable. Conclusion: in future direction, beta-cyclodextrin continue to be a molecule of great interest due to its ability to improve drug properties, right? Improve the pharmacokinetics, even pharmacodynamics, so it will change the therapeutic outcome. And we must have research. There is ongoing research applications for all the cyclodextrin-based drugs. And most of the big pharma currently, they are loading their drugs into cyclodextrin, cancer drugs, anti-inflammatory peptides, RNAs. So it does. You will see a lot of drugs that's being converted into cyclodextrin based. Okay, I do have a background of my son is playing, so I need to move him. Shaboob, Adir.
Halasa,
Dr. Patel, go ahead. What do you have?
the question is that is it used in the nasal spray to increase the absorption?
Yes. So you can use it for nasal spray. You can use oxytocin, Clotho, all of these drugs. You can sort of complex it with progesterone and use it for intranasal, ophthalmic eye drops, topical, anything you want.
No, but the
And it will be
peptide
good.
delivery would be increased because they are water soluble. So
Right, and then protect the drug. It has many advantage when most of the big pharma drugs are moving to this direction. And then if you clock them with platelet nanoparticle, you would add more value to it.
so is it to be used in a 1% solution, or how many percent solution do you
I
use?
think most of the time they use the same gram. Let's say if you have 10 milligram of a drug, you use 10 milligram of cyclodextrin.
Okay, equal
Because
amount.
of its molecular weight is most of the time bigger.
So it's a
And
50%.
Can't hear you.
yeah, the ratio is 1-to-1 most of the time, milligram. So what other thing about the cyclodextrin that's unique? It has anti-inflammatory effect. So it does inhibit the pro-inflammatory cytokines. That's a good thing, right? Especially when you are managing atherosclerosis. In addition, you want to get rid from all this extra fat that's being deposited into those macrophages and those plaques, what cyclodextrin can do. We need to also decrease their inflammation. And so cyclodextrin does help to block or inhibit the pro-inflammatory cytokines, especially interleukin-1 B. And so it does help. It works like an anti-inflammatory drug. So it's a base, but also it has an active pharmaceutical quality, which is an anti-inflammatory. And by modulating the activity of the cytokines, beta-cyclodextrin may help to reduce the inflammatory response and slow the progression of the disease. That's a good thing, right? You know, it's like 3 birds with 1 stone, and maybe more. Therapeutic implication: the dual role of beta-cyclodextrin in managing cholesterol level are and inhibiting pro-inflammatory cytokines positions it as a valuable therapeutic agent in management of atherosclerosis. That's a good thing. So what you do in atherosclerosis, we have 2 things. We have fat flakes deposit in the macrophages and those blood vessels. And you need 2 things. You need to have this anti-inflammatory effect, and also we need to chelate and detox and collect all those extra fat and load them inside this cargo of cyclodextrin. And that's what cyclodextrin does. So it puts the inflammation down, plus it will collect the fat from inside the macrophages and clean them up. It's similar to high density lipoprotein, but it's even way more effective because it gets into the blood vessels wall and cleans it from the fat and decrease the inflammation. Because atherosclerosis is not just fat plaques, but also part of it is inflammatory process and fibrosis. And if you have something that has anti-inflammatory effect, I don't know if it has an anti-fibrotic effect, but anti-inflammatory effect, in addition to clearing the blood vessels from all this extra fat, plaques, that's plaques. That's a good thing for management atherosclerosis. So it addresses two fundamental aspects of the disease: the cholesterol-induced plaque formation, inflammation, and this suggests that could be an effective component of comprehensive treatment strategy. And that's why, you take cyclodextrin, you load it with nitroxide donors. You load it with, name it, nitrate, vitamin C, alpha-lipoic acid. That's a good thing as a nitroxide donor. So you take those capsules of nitroxide supplements and you load them with cyclodextrin. I think that will be a very good formulation for managing atherosclerosis, better than just nitric oxide only.
Yeah, well, Dr. Halasa, how does it remove the cholesterol? I mean, you say it removes it. How does it remove the cholesterol? How does that happen?
Can you repeat that?
How does it remove the cholesterol? You say it removes cholesterol from the streaks, from the mast cells. How does it do that? It's one thing to say it. What's the mechanism?
It's similar to high density lipoprotein. It goes inside, the macrophage will take them, and those globs of fat inside those macrophages, they will be going inside this, this circle or this,
it's a hydrophobic.
The hydrophobic part of it, exactly. It will load it like a cargo, because inside is fat, fat soluble. The outside is water soluble. So the macrophage will take it, and then if there's any fat there, it will start suck them inside those globe of those cyclodextrins, and so they like a cargo, and carrying all this fat from the blood vessel, from the tissue, interstitial tissue. It starts collecting, attracting all the fat, because the fat, when it goes inside, they get trapped inside that globe, inside that truck of cyclodextrin.
Has this been measured? Is it measured or it's theoretical? Has this been measured?
No, it is. It shows that, yes, it shows that it helps in managing atherosclerosis in lots of patients. And who brought this to me? Dr. Klatz. He said, I have problem with my blood vessels, atherosclerosis, and I have dyspnea, walking the stairs, and then he took cyclodextrin loaded with one of the supplements, maybe
the Capodex,
quercetin, loaded with cyclodextrin, and he said he got improved. His tolerance of exercise increased, and he can walk more, and he can walk the street and all that stuff, which it's an evidence that it does manage atherosclerosis, and it does.
How about objective measurements, though? I mean, if they repeat,
do we have any publications and articles? Yes, and I was sure that publications and articles about the application of cyclodextrin. All of this they have references, and if you ask me about the references, I'll go ahead and send it to you. You have my cell phone. Just ask me for it, and I'll send it.
Yeah, thank you.
But this is a good thing, and what I'm thinking about is to all this nitroxide supplements is to do it in a form of cyclodextrin-based nitroxide supplement. There's a lot of application there. I mean, all the drugs and supplement I'm considering now to be loaded inside cyclodextrin.
So, Dr. Halasa, then does it absorb the cyclodextrin, absorb the molecule of the other drug? And if that is so, then why cannot be used in cancer patients when you're giving them the chemo or immunotherapy? If it does not change the structure of the medicine, and at the same time, there is a better delivery.
Yes. So do you remember when I told you that there's a big pharma out there, regardless of the name, they are stabilizing it using polymers. They're not using this cyclodextrin, but using others, maybe PLGA or whatever. And so that process, it can be done with cyclodextrin and stabilize the chemotherapy drugs and even antibodies and even messenger RNA. Same thing when you do your platelets clocking with the phospholipid bilayer membrane of the.
Yeah. So it would work similar
It
to.
will work similar, but still you can clock it after you finish from stabilizing it with cyclodextrin as a polymer. You still use platelets membrane. And why? Because the membrane of platelets will be more hijacking than cyclodextrin, because cyclodextrin still is a polymer. And if you just use the cyclodextrin for cancer, you still have a chance that macrophages of the liver and the lung will intercept them and take them in. But if you clock them with the platelets nanoparticle, most of the time the macrophage will see it as self components, and they will allow it to pass without being intercepted. So you get the drug better into the target.
So right, but if somebody has a lung cancer.
Yeah, so if in case of lung cancer, but still you have the liver macrophages, spleen macrophages. So I mean, I prefer an extra step after you do the cyclodextrin loaded, you do also platelets, because that's what the other company does, and they're doing it not for targeting, they're doing it for stabilizing the drug, so it's got more longer shelf of life. But as clinician, we are not looking for that. But because now it is accessible, and this company is, regardless of the name of it, yeah, I mean, they are perfecting the whole protocols and all that stuff. So I like to move forward with using all the drugs and supplement based on cyclodextrin, and that's my plan. That's that me and Dr. Klaas are working on. It makes sense? Okay, so let's go ahead to, so the future direction. Ongoing research is focused on further elucidating the mechanism by which beta-cyclodextrin exerts its effects and optimizing its use in clinical settings. And that's what we are working on, of course. As I said, already big pharma companies, big ones I'm talking about, they are using cyclodextrin to convert the drugs. And there's already drugs out there that is already loaded with cyclodextrin, especially antifungal drugs. Why antifungal drug? Because an antifungal drug loaded with cyclodextrin, it's like two birds with one stone. The antifungal drug itself will kill the fungus, and the cyclodextrin, which wrapped it, it helps to detox the mycotoxins. So it's a good thing, and there's already antifungal drugs out there commercially that they are loaded with a cyclodextrin. I will choose those ones, but I will also do methylene blue and load it with cyclodextrin and use that, right? And there are already publications about cyclodextrin loaded with methylene blue. That would be the best. So methylene blue will kill the fungus, and the cyclodextrin itself will detox the mycotoxins, because we do have a problem, right? Remember one of the doctor that is doing all this antifungal thing and consider everything is fungal infection, all the disease.
Campbell, you're talking
right.
about.
So, and they have a problem. And he said we don't have anything that will detox or chelate mycotoxin. Now we do now, which is cyclodextrin, and especially if you load inside methylene blue or antifungal. I like methylene blue in the beginning. I mean, if you see, those. What's the name of it for the fish tanks, right? When they get contaminated with fungus, how they treat it and turn it into completely crystal clear. They use methylene blue. So methylene blue is very powerful antifungal drug, and I think it's a good thing that we can use it and it's more safer, less toxic to the liver because it does not interfere with the mitochondria. In fact, it activates the mitochondria. And so loaded side cyclodextrin give that. And there's already publication for that. And just give them red lights, expose the body to red light after the IV methylene blue loaded cyclodextrin or cyclodextrin loaded with methylene blue, taking it orally. But then if that does not work, then you go ahead and say, okay, let me move forward and start doing antifungal. But I like to start with, you know, the easy one and affordable one, and then move on to the next level if needed. Advanced pharmaceutical design may lead to development of beta-cyclodextrin derivatives of formulation and enhance its efficacy and specificity in targeting atherosclerosis process. So now we can load drugs. We can put some anti-inflammatory NSAID in it. We can put many things that will antiplatelet and load cyclodextrin and get them into the blood vessels. Or we can use nitric oxide supplements and load them inside cyclodextrin, right? I think that will be innovative ideas. In summary, beta-cyclodextrin role managing atherosclerosis is supported by its cholesterol complex formation and anti-inflammatory properties, offering a two-pronged approach to both prevent and treat chronic cardiovascular conditions. As the research progresses, the potential of beta-cyclodextrin to integrate it into therapeutic regimens for atherosclerosis continue to grow. And I think us as CDPM, we will be leading this project along with our compounding pharmacies that we like to work with. Detoxifying mycotoxin, that's another application. And I think this is the only drug that detox the mycotoxins. And therochelation is a complex process that involves several strategies. Here is the expanded and organized explanation of how beta-cyclodextrin can be used in this context. Mycotoxin are toxic compounds produced by fungus, such as those from the genera Fusarium and Aspergillus and Penicillium. And these substances can contaminate the food and feed, and leading to various health tissue in humans, but also can infect the body, right? We have fungus that affects the body, albicans and many others. Or, you know, you consume it for the food. And those mycotoxins are carcinogenic and genotoxic and teratogenic, hepatotoxic, and we need to clear it, right? And so this cyclodextrin would help for both. You know, clinically, you can use it for the patients to get rid from the mycotoxin in the body that's already circulating in the blood and the tissue, and also you can use it in the food industry, and also in fishing tanks as well, along with methylene blue, to clear the those feed and from mycotoxins. Chelation with beta-cyclodextrin is known for its ability to form inclusion complex with various substances, including mycotoxins. Again, it also leads to detoxing fat-soluble toxins, all those fat petrochemicals that we are taking and exposed to the smoke, those organophosphorus, all those pesticides. We can definitely help to detox the body from it using cyclodextrin, especially during the process of weight loss. And all those fat-soluble toxins that's been stored in the fat, I think we need to clear them up. And I think now we have something that would help. In addition to the sweating, that Dr. Patel likes to entertain us, the process of sweating, the sauna, right? Sweating is also a good thing, you know. And after you do the sauna and you sweat, then you start washing out. So you don't need to, so that the fat soluble toxin will not reabsorb again. But adding cyclodextrin IV loaded with detox, EDTA, possibly, and glutathiones and NAC and all those things may help to enhance the detoxification during weight loss. So I will recommend detoxing and possibly complex EDTA and glutathione and NAC and many others with cyclodextrin, and do it as an IV so you can get rid from.
So this is a one more important thing. What it says that it encapsulates the mycotoxins within the hydrophobic cavity. So it is really doing more like a cloaking, like
Right.
platelet membrane, how it cloaks the molecule chemotherapy and makes the encapsulation, and then it brings it in the body. But here it encapsulates the mycotoxin within the center of the cyclodextrin. And not
Right.
only that, then it goes through and gets out in the stool, urine, and it goes through the liver. Now, in the liver, you say that the macrophages, what is the interaction of this cyclodextrin and macrophages? I mean, you were
Oh,
talking
about the macrophages that's being formed like a foam.
in the liver.
No, not in the liver, the blood vessels. In the liver, it will be excreted with the bile.
Right. So that is my fear, that if these cyclodextrin, which encapsulates the mycotoxin, and then it goes in the liver, and if macrophages just swallows them, then the mycotoxin will be delivered there.
Well, eventually, even the macrophages, if they swallow them, and the macrophages or the liver cells will go and kick them out to the bile, because they consider as a fat soluble particles. So it will be excreted out from the liver, and it will clean the liver. Got my point? So basically, eventually it will end up in the bile.
So it will be then depending upon the liver function. If the liver is functioning normally, then it will go out. Because to me, it seems like the mycotoxin may cause more problem in the liver. But
no, the liver, if it's function, as you said, because you need to have a functional excretory organs, they will secrete all those extra things as it's a fat particles outside in the bile. So that's one of the way it gets rid from the cyclodextrin, loaded with mycotoxins and loaded with it's like high density lipoproteins.
So then it can also trap the toxic metal too in it. That means if they can do mycotoxin, they can do the toxic metals.
Right. That's the reason I'd like to integrate it with loaded with EDTA.
EDTA, yes.
EDTA, right? So you can have it all a pack with glutathiones and NAC and pack it all together, and in a ratio of 1:1. I think that will be a good idea, the optimal way of detoxing the body, whether you give it IV or oral or even rectal. Okay, so let's move on to detoxification, other application of cyclodextrin. It helps to detoxify fat-soluble toxins. And we just talked about it, all those petrochemicals, organophosphorus. This will help because it worked like a cargo that will absorb all this fat-soluble toxins and dump them out through the urine or through the liver bile. And it's increasingly recognized for its utility in enhancing the solubility of lipophilic substance. And its structure allows it to form an inclusion complex like a cargo with variety of molecules, particularly those with fat-soluble toxins, right? And we have many of them out there, pesticides, petrochemicals, all the smoke that we are exposed in our modern life. So the rule in detoxification, why beta-cyclodextrin is not a direct participant in body metabolic detoxification pathway, it plays a supportive role in the detoxification process as a chelation agent, and its ability to increase solubility of fat-soluble toxin is instrumental in their excretion, right? So basically, you still have to have a functioning liver to take those complex and get rid from it in the bile. So mechanism of action: binding of toxins. It has a hydrophilic core, central cavity, and hydrophilic outer surface, which enable it to encapsulate hydrophobic molecules such as fat-soluble toxins. Good. Okay, so what other applications? It helps to increase solubility of drugs. So if you have chemotherapy drug, if you have peptides, if you have any fat-soluble drug, progesterone, then you can go ahead and use cyclodextrin to increase its solubility in water by forming complex with this drug. We're still in the toxins. Okay. So that's one way. But the other thing is here they talked about that we still can detox those fat-soluble toxins because of its core hydrophobic, and that will load all those fat-soluble toxins in the core and increase its solubility in aqueous environment, yes, which is crucial step for their subsequent removal from the body. Right. So one of the hurdle that we have of the fat-soluble toxins, they get inside the fat tissue and they stay there and they start releasing slowly into the body and causing all this toxic effect. So, and we don't have in the past anything that will chelate them because most of our detox is water soluble. And now we have something that will help to take those fat and turn it into water soluble. Once turned into water soluble, your body can easily deal with it and excrete it. And so, facilation of excretion increases the ability of these toxins, enhances the ability to be transported through the excretory pathways, whether through the kidney or the sweat or through the body, and eliminate from the body. Again, you know, the xenoestrogens is one of the things that we have hard time to get rid from it. I mean, sweating and the sauna, it's one way of doing it, but I think now we can get rid from all this extra sex hormones, especially the xenoestrogens, using cyclodextrin. So it's good for managing estrogen dominant syndrome. So progesterone loaded with cyclodextrin is like two birds with one stone. The cyclodextrin will help in detoxing the xenoestrogen, while the progesterone will inhibit the aromatase and balance the sex hormone and maintain the ratio that we are looking for.
But the question is, Dr. Halasa, is that it says that it facilitates the removal of excess hormones that are typically bound to bile acids. The excess hormones are having the ill effects all over in different organs. So it should be not just removing from the bile acids, but it should be removing from deposition, sequestered. I would say that they are sequestered in the membranes, sequestered in the organs, in the mitochondrial membranes, sequestered in the endoplasmic reticulum, depending upon there are all different places these hormones get metabolized. So they may be in different places. So I mean, I think it should be removing also from those membranes, not just the removal of excess hormones only into the bile acid, from the bile acids. So I have a question there.
What happened is that it facilitates the removal of the excess of hormones that are typically bound to the bile acids. So, you know, after you get the excess of hormone, let's say xenoestrogens, and then you have loaded inside a cyclodextrin, how it's going to get rid from it, the body, they will be dealing it as it's a fat thing, and the liver will take them and secrete it through the bile. That's what it says here. You got my point?
Yes.
Yeah. But again, you know, this is AI generated lecture, by the way, with my help in editing, but there's a lot of things, you know, my name, yeah, so, but it's a good version of what we're looking for. And basically getting rid from xenoestrogen, it's a dream of us, right? You know, we have a problem getting rid from it. And the only thing that we know is by sweating and sauna. Now we have something that make more sense to get rid from the xenoestrogens. And that's why progesterone loaded with cyclodextrin, it's critical. It's something that we need to do. And all the sex hormones, testosterone and estradiol, it would be good if they are all loaded with cyclodextrin. The inclusion of beta-cyclodextrin in detoxification protocol can be a valuable strategy for enhancing elimination of fat-soluble toxins that will be supporting overall health and well-being. So this is very good news, especially for you, because you are the environmental doctor. I think this is good news for your specialty. I mean, you spend a lot of time in teaching and educating about the detoxing the body and using what's available that we have. Now you're adding some other arsenal and another tool that helps to solve the problem of the fat soluble, because it was big concern for you in the past, and I think now there's an answer for it, right?
Yes. Yes.
Drug loading and nanomedicine. So the other thing is that about the beauty of cyclodextrin is that I can use it to make nanoparticles. Again, does that mean this will replace the platelets nanoparticle? No. We still need the clocking it with platelets to increase its efficacy, because still the cyclodextrin is polymer, and your macrophages, the liver and the spleen consider it as a foreign, and they will take it and intercept it. And I want that, especially if I have a tumor in the brain, I want all the drugs to go to the brain, not to be intercepted by the liver and by the spleen macrophages. So therefore, after I do the cyclodextrin thing, loading it, then I'll go ahead and clock them with the platelets membrane. And I think, especially for the cancer drugs, I think I can get better result out of doing it. And there's publication that shows that doxorubicin loaded with platelets nanoparticle is more effective than doxorubicin loaded with polymers, PLGA. And so it's a good thing for loading drugs inside in the form of platelets nanoparticle. And we know that the advantage of platelets nanoparticle, they tend to leak into pathological tissue because the blood vessels are leaky, versus the healthy tissue, the blood vessels are tight, and this will favor the drug to be concentrated in the pathology versus healthy tissue.
A quick question
for targeting. Yes, go ahead.
Dr. Halasa. Now, the beautiful thing about this cyclodextrin is that I started coming across articles regarding its use with influenza A virus. In fact, I saw an article where they were enhancing cytosine and mixing it with a nanoparticle in order to fight off H1N1. And that was, the purpose was to pull the cholesterol out of the viral membrane, which I thought, wow, just like pulling out the cholesterol from the foam cells that are maybe overloaded. But in a more recent article, I saw that they were doing work with cyclodextrin and adding sialic acid, which is really the binding site of the hemagglutinin part of the H5N1, which is really the concern, such that the H5N1, the bird flu, will bind to the cyclodextrin instead of binding to our tracheal epithelium and get trapped in the fat soluble interior. Is this a possibility, do you think?
Yes. It will inhibit the diffusion process. The virus, when they attach to the cell, it will go through a process called fusion, where it will release its content inside the cells. This interaction between the membrane of the host and the membrane of the virus will be intercepted, same way like a soap. Yes, it will kind of break that from happening using cyclodextrin. It's true. And it's not just for N1H1, but also for COVID-19 coronavirus. So it does have antiviral effect, and we're going to see that in the coming slides. So, and I thank you for the article that you sent about it. But it's good for it. It is an antiviral. It has antiviral effect as well. And so we have this antifungal, antiviral, mycotoxin absorption, many things There's many application here for cyclodextrin. That's why loading it with inside methylene blue and using the methylene blue itself to block the spike protein and the cyclodextrin to kind of inhibit the fusion process of the virus with the host. All of this helps as well, and so that's the reason we can load antiviral drugs or methylene blue with cyclodextrin to enhance its efficacy. That's right. So
expensive? Is it very expensive or?
no, it's very affordable. No, it's not expensive. It's actually considered as a base, but it has an active pharmaceutical activities as well on the side. But most of the big pharma, they are using it as a delivery agent so that they will not go through extensive application of its active pharmaceutical part of it, right? So the big pharma are very smart. They don't want to mention anything about its active pharmaceutical because then they have to go through extensive clinical application to prove it. But they use it as a delivery. And most of the big pharma, they are using now or start developing drugs based on cyclodextrins. There's a lot of antifungal drugs already being turned into cyclodextrin based. And we can do that in the compounding pharmacy arena as well. And that's my plan, including also the supplements. All of them can be cyclodextrin based. So it's like two birds with one stone. And so it's molecular structural law to form an inclusion complex with various drugs, enhancing their solubility and stability and targeting. What is the advantage of nanoparticle conjugate? It enhances the water solubility. That's a good thing. Making it more bioavailable to increase the drug loading capacity, right? And so inclusion complex formation allow for higher amount of drugs to be loaded within the nanoparticle. And you can mix anything. You can do antibodies with chemo drug, with small molecules, with peptides, all of them, and put them in one pack. It's like wrapping them inside an envelope. Target delivery, as we know that the pathology blood vessels are leaky, so they tend to seep through those leaky blood vessels and concentrate more into pathology versus healthy tissue. And that's a good thing because this will reduce the systemic toxicity for the drugs for going everywhere. So if you get naked drug, it goes everywhere. And so it gives you toxic effect into the healthy tissue. I don't want the drug to go everywhere. I want the drug to go to the pathology, so minimize the systemic toxicity. Greater surface area. This property facilitates more drugs interaction and binding opportunities. That's a good thing, especially even when you have problem with antibiotics that has resistant, and the bacteria develop some resistant. Those receptors that pick up those antibiotics mutated, change. Then with this, you can bypass that and enter the bacteria through endocytosis. So I think it's a good thing. And it also helped to increase the surface interaction of the drug with the host as well. And most of the time, they go through endocytosis in a state of the active transporters, carriers that in the membrane. Higher stability, of course, the cyclodextrin, they wrap the drug and they will resist the gastric acid enzymes and acidity and also the pancreatic enzymes. So it will help in forming oral drugs that will absorb without being degraded by the enzymes and the acids and the alkaline of the GI tract. But also it helps to protect those drugs from being degraded by the blood enzymes as the drug gets inside the body. So it's a good thing, right, for structural stability and protecting the drug from premature degradation. What is the impact of beta-cyclodextrin concentration? Production of smaller nanoparticle. Higher concentration of beta-cyclodextrin lead to formation of small nanoparticle, which can penetrate the biological barrier more effectively, right? Through endocytosis and also when you take it orally, it will go through the lymphatics, so it will bypass the first metabolism, which is the liver. Definitely, it has very high absorption and you can load the drug in a very high inside those particles. The size of nanoparticle decrease, the drug loading efficacy increase, allowing for more potent therapeutic effect. And so you're packing them inside those package, and you can deliver a lot of drugs at once through this pack because it will go in through endocytosis. Comparative stability with other nanocarriers, compared to other nanocarriers like microparticles and liposomes, I prefer cyclodextrin because of its superior stability, which is crucial for maintaining integrity of the drug during storage and transport. All right, so if you tell me which one is more stable, the cyclodextrin is better than liposomes. So
yeah, but what about when you have a liposomal drug? Is it beneficial to use cyclodextrin with it?
Well, liposomal drug means that you wrap them inside phospholipid bilayer membrane, right?
Yeah, like docetaxel, you know.
Right. So
it is a liposomal, it is more
yeah,
expensive.
you don't use, you can go and do the drug with cyclodextrin first, and then you wrap them with side liposome. That's fine. But
right, but that's
yeah,
we cannot do it in our labs. Our labs, the liposomal product is available commercially,
right.
and want to increase the higher drug loading.
So what we do in our clinic, you can take cyclodextrin, mix it with the drug first, with your sonication, and then you go ahead and you clock it with the platelets nanoparticle membrane.
Okay,
that's something.
So you don't have to use the liposomal. You can use the cheaper version of liposomal.
Yeah, you can use the platelets membrane, which is autologous. It's better than, because if you use still liposomal, most of the time it's still considered as in your body as a foreign. I like the way that you can cyclodextrin it and then clock it with a platelets nanoparticle if you're doing IVs. If you're doing just oral, just cyclodextrin it and give it orally.
No, but in our IPT, we give the drug after we induce the hypoglycemia. So then you are giving the drug by itself. So I was thinking that if you are doing that way, you're just having the diluted drug in the syringes, and that dilution, if you use dextrin with it, you may have a better delivery system. But that was my question.
Yes, anything mixed with cyclodextrin, you will have better absorption, stability, and targeting to the pathology.
But then you said it is a nano delivery system and targeted nano delivery system.
Right.
If it is targeted nano delivery system, that means that you just mix it with dextrocycline, and whatever drug you have, you mix it with dextrocycline. You don't have to process anything further, and then you just give IV. What are the chances of one having the anaphylactic reaction or allergic reaction?
Oh, you wanna say you don't need the platelets nanoparticle, just give it cyclodextrin, right?
Yeah. Instead of that,
so the problem with that is this: if you have a mass in the brain and you do cyclodextrin loaded drug, the problem with cyclodextrin, yes, it does have target therapy better than the naked. That's right. But but still, there's a problem with it. It will be picked up, intercepted by the macrophages of the liver and the lung, so you get less going to the brain. Comparing if you clock them with a platelets nanoparticle, that will lead to override the interception of the.
Okay, so that means that when you are giving the drug, chemo drug, I'm talking about naked chemo drug.
Right.
After diluted by the slow IV push, that is the time there is a question. If you mix it with, I mean, if it goes by itself, you don't think that the macrophages are going to get them?
If you just give them naked drugs, it will go to everywhere, to healthy tissue and pathology. If you give them with cyclodextrin, it will go to the pathology, plus it will be interrupted by macrophages of the liver and the lung. If you give it platelets nanoparticle, it gets better into the target pathology because you escape.
That is true, but I'm talking about That is if you are doing the nano treatment. But
Right.
we are using 2-3 different treatments depending upon what the patient wants. Sometimes they want just the insulin potentiated. They don't understand the other treatment. Okay, insulin potentiated is well-known treatment. And
Right.
insulin potentiated, once you reduce the blood sugar up to a certain extent and give the naked medicine, it tends to go more towards where the cancer cells are, because those pores are open as compared to the normal tissue. And you can use the lower dose similar to for the nano. So my question is that is the delivery is better to the cancer
I think
cell,
it's better.
but it's
It's
a
better
targeted delivery.
because the pathology if it's still it's better because the blood vessels of the pathology it's leaky and the healthy tissue is tight. So if you want to get the pathology, that will be nanoparticles is better. And because the cyclodextrin is sugar, so and you said you already have low sugar, they may have a tendency to attract those receptors to the cancer cells to attract to those cyclodextrin because they see it's a sugar particulate connected together as a polymer, but still a sugar. So I think it's
Not
better.
the sugar, it's a cancer cells love sugar. And it will go to the cyclodextrin being sugar,
Right.
it will go to the cancer cell.
Yes. That's why the cyclodextrin will be good. Again, the platelet nanoparticle has advantage of bypassing.
No, that I understand it completely.
Right.
But when you are using the IPT treatment, is it question is if in case of IPT treatment, is cyclodextrin will enhance the delivery of the drug, targeted delivery of the drug, and not only that, but increases the effectiveness of the drug delivered to the cancer cell.
Right. Yes.
How would it increase the effectiveness of the drug delivered to the cancer cell? That I have
Two
a
option, two. If you start them, the cancer cells, they increase the receptors for the sugar, including the cyclodextrin components, which is sugar. This is one. And the second part is passively because the pathology is more leaky than the healthy tissue. And so you get more concentrated of those particles in the pathology versus the healthy tissue. That's
no,
true.
I understand that the delivery will be more to the cancer cell, but how the cyclodextrin will increase the effectiveness of the chemo in the cancer cells?
As you're talking about the dynamic.
Yes, yes.
Just increasing the concentration of the chemotherapy in the drug itself, it will add more value to that chemo drug that you're giving. Whether the cyclodextrin has anti-cancer effect.
Whereas cyclodextrin will last longer than the chemo drug inside the cell. Because
yes, it will concentrate more and
so it will be longer time effect. That's what I'm thinking of, because it has that hydrophobic central structure.
Right.
It may be that it will transfer the drug from the outer surface to the inner surface. It will concentrate in the center and then deliver it gradually in the cancer cells. So the effect will last longer. That's what I think. But
yes,
I just
that's part of it. Inside the cell, inside the tissue, it will last longer, releasing those drugs from those particles. I agree. But is that cyclodextrin has direct anti-cancer effect, similar to has direct antiviral effect by inhibiting the infusion and things like
no,
that?
but how can it have an anti-cancer effect?
I don't know yet. I did not look at it, but I
No,
want to look at that. Maybe
yeah.
you will see some property of cyclodextrin as an anti-cancer, as we saw it inhibit the fusion of the virus to the host. So that's one of mechanism. I don't know
But
yet.
similar to maybe for antifungal, how does it kill the fungus? Because in the genesis of cancer, fungus is one of the factors that they are
It
encountering.
will help to absorb the mycotoxins, so that's we know. Whether it does have toxic effect of the fungus, also I want you to explore that and look at the property of antifungal like methylene blue and what it does in the fungal. Look at what cyclodextrin does into the fungal. Maybe it does have some antifungal directly. I don't know yet. That's something you and Dr. Joseph James will investigate it and then come up with a lecture on it. Make sense?
Yes, thank you.
Okay, sure. So the conclusion, the incorporation of beta-cyclodextrin into nanoparticle design is promising strategy to enhance the drug loading, solubility, and delivery, its ability to stable inclusion complexes with the drug, and to produce smaller and more efficient nanoparticle, make it a valuable component in development of advanced nanomedicine, right? This is something that as chronic disease prevention management docs, we are entertaining this field of medicine, of nanomedicine, as part of our curriculum and our specialty. By optimizing the concentration of fertilizing beta-cyclodextrin, researchers can create nanomedicine with higher drug loading capacity and improved delivery mechanism, potentially leading to more efficacy or effectiveness, and we talked about it in detail. Okay, so it does have enhanced antimicrobial efficacy with cyclodextrin. Cyclodextrin are the family of cyclic oligosaccharides known for their ability to form inclusion complex with various molecules. And this characteristic can be particular benefit in field of infectious disease, where cyclodextrins have found to improve the performance of antimicrobial agents. So if you have a resistance of any antimicrobial agents, you load on cyclodextrin, it will break that resistance. That antimicrobial depend on certain receptor in the bacteria to get them in. This will be bypassed because of the nanoparticles and its effect in getting inside the cells, maybe by endocytosis, bypassing that resistance. Solubility enhancement, one of the primary change with many antifungal drugs is their poor solubility. So I think it enhanced antimicrobial. Some of those antifungal, they are fat soluble or poorly water soluble, so you can turn them into water soluble by complexing it with antifungal, which will increase this absorption and its targeting effect onto the fungus. And so cyclodextrin can address this by increasing the solubility of these drugs. This mechanism involves the formation of non-covalent inclusion complex, where the hydrophobic drug's molecule is encapsulated within the hydrophobic cavity of the cyclodextrin molecule. And this process can signify or significantly enhance the solubility of the drug. I think that's what we're looking for, changing the pharmacokinetic, making it more readily available with aqueous environment. So it's getting it more into the target and a better absorption, better protection, and getting it into the fungus.
So Dr. Halasa, can you please go through the previous slide, please?
Yes.
Okay, it says that it in the first cyclodextrin first paragraph, it says that it has been found to improve the performance of antimicrobial agents. How does that do that?
By, let's say, antifungal drug that's hydrophilic. Oh, sorry, it's hydrophobic.
But
And
we are talking about antimicrobial agents.
yeah,
So I'm not
antifungal
talking about regular methylene blue.
I'm talking about
talk
any
about
antifungal drug out there. Some of them,
antibiotic.
yeah.
Antibiotic. Let's put antibiotic there.
Well, antibiotic, it could be antifungal, right?
Antimicrobial agents, yes,
Yeah.
it
So it
can
could
be.
be,
But I'm thinking more about antibiotic because antibiotics. If some antibiotics you have to give every 6 hours, every 8 hours, every 12 hours. So
so again, it will increase to change the pharmacokinetics. It makes it stays longer in the body, slowly release them, so turning from fast effect to slow. Plus, it helps to absorb, make them more soluble to the water, so the absorption is better. So if you take antifungal naked, you don't get much of absorption because they are poorly absorbed and soluble in water. So turn it into soluble water will increase their absorption, and that will increase its efficacy because you're increasing the concentration of the fungus inside the body. So you're changing the pharmacokinetics. Changing pharmacokinetics can increase the efficacy of antifungal. That's whatever. Now it does. Now it has direct effect on the fungus infection, on the fungal intercept or interrupt their metabolism and kill the fungus, so they have fungicidal effect. I don't know. That's the reason I want you to look at it, but I know it increases the efficacy by changing the pharmacokinetics. And the other thing, it helps to absorb the mycotoxins and get rid from it. So that's another way of this. And we talked about its antiviral effect. Yes, antiviral, very clear. It inhibits the viral, especially the enveloped viruses. The virus has envelope membrane. It does disrupt them and preventing it from fusion with the host and preventing that interaction from happening. So it does have sidal effect on the virus, or blocks its interaction with the host. I don't know if there's any sidal effect of cyclodextrin over the bacterial fungus yet. That's where, or the cancer. That's why I need you to look at it, you and Dr. Joseph James, and come up with an extension lecture for this.
Yeah, I only know with H1N1 that it's pulling the cholesterol from the viral membrane and that's disrupting its function, or if they are adding sialic acid to the cyclodextrin, then it's causing the H5N1 to bind to the sialic acid as if it would be binding to the sialic acid on an epithelial cell. Instead, it's going inside of the lipophilic inside of the cyclodextrin and being trapped. So that's how I know it's working. Or they are also adding cyclizine. I'm sorry, cyclizine to it, and you get the dual action of the cyclodextrin that might be pulling out the cholesterol from the viral membrane, at the same time having the antiviral effect from the cyclizine, but at the same time the cyclizine being delivered to the brain is also enhancing the nicotinic receptors that may be affected by the virus or antagonized by the virus, as to prevent any sort of respiratory paralysis and other issues that are nicotinic related.
Right.
So what about then, Dr. Jain? What about the effect on the fat cells in the fatty membranes in the brain?
Well, that's a
cell
great
membrane.
question.
The neuron, you know, I mean,
Yeah,
it
that's
does,
a that's
what
a
kind of
that's a great,
selectivity does it have? Right.
yeah. Well, I think it's only selected for cholesterol, and I don't think that when we think of phospholipid membranes, is there cholesterol literally in the brain cells?
Yes,
There has
but
to be some, yes, there has to
yes,
be.
there is. But again, it seems like the cyclodextrin works on the viral versus working on the human cells. Selective
Do they have any receptors?
for cyclodextrin.
Uh-huh.
We don't have any information about right now. I don't, and it needs further research from your guys to see if there's any target sidal changing metabolism of the bacteria or virus or fungus, except the things that we are talking right now. So it requires some more investigation from both.
Yeah, I would say my initial impressions were that the cholesterol that would be taken away from like atherosclerosis or from a virus were just enough to affect those things appropriately, but not enough to affect our own cells.
Yeah,
that was my initial impression.
That's right. That's exactly true.
So it wouldn't do anything to the spike proteins then, right? In our
No, it does work with the spike protein. I said we talked. Well, it works on the fusion effect in general, not specifically spike.
So what about our long COVID patient?
Well, I don't have anything about cyclodextrin interact with the spike, so I don't know if it
So
helps
Dr.
unless the
Joseph, have
spike
you
is
looked
fat
into
soluble.
that?
Unless the spike is fat soluble in detoxing the spike, I don't have information. Possibly does. Only thing I know, it does inhibit the virus from interacting the host by inhibiting the fusion. Now we need some people like you and Dr. Joseph to further investigate if they cause
If I have the access to this molecule, I can try it, because you know, even if it is present in the literature, but when you try on patient, if it is not effective, then you know there is some gap somewhere.
so all of what we just said here, it has publications and references clinically. So everything we say, it's in this lecture, it's out of publication. So we're good. Anything else we need to investigate it and look at clinical researches for the spike, the protein detox, for other things that, for the sidal effect on the bacteria directly or fungal. All of this we need to further investigate. And all of you as doctors, I'm just trying to trigger this, you know, and help you to start doing your work from your
We
side.
did not discuss about any dosages of this. So
again, most of the pharmaceutical companies, they use this as a delivery. They don't really talk about active part of it, because if they start talking about the active part, they use it as an inert delivery, as an inert part of the drug, not as an active part. And we are just exploring here as clinicians and doctors that it does have an active pharmaceutical effect, not just inert, and good effect. And that's
Dr. Klatz has been using it. So how many milligram capsule is it available in?
I think the ratio most of the time is 1:1.
No,
So,
but the capsule, what are the names of the capsules that we can try it out?
there is one, but I don't know the names, because first of all, this is CME. We cannot mention the names of the drugs, but Dr. Klatz has used it with mixed with quercetin. I don't know the name of it, and I don't want to mention it here if even Dr. Klatz is here. But after the CME, you can reach out to him and talk to him about one supplement that has cyclodextrin.
Yeah, I think this is very important. The fact that we're opening up the door, because this bird flu, however you see it, is a threat. It's just for the election to make everybody scared. I don't know about you people, but I want to be prepared and not to get, scared or worried. But all we have to know is how the bird flu works, and then understanding cyclodextrin. I think it's something that's easily accessible. There are lots of articles on this and the other, H1N1, the other influenza A, the other subtypes. But what's most important is this H5N1, and understanding that, my understanding from my initial impression is that they were trying to find the right size cyclodextrin, the size of the sialic acid, because the sialic acid is meant to be the same size as the sialic acid receptors that we have in our epithelium and on our red blood cells. And all I do know is that the H5N1, the bird flu, is very aggressive. I know that there's always going to be the flip side. You'll hear the stories that, no, it's just this isn't going to infect humans. This is an animal thing. Right now, I don't believe anything like that, because everything is manipulated. Maybe I'm not supposed to say that on CME, but it seems like, they can manipulate anything. And, if this thing has such a high mortality rate, what are we waiting around for? I mean, seriously. Like, we're doctors. Like, what are we brain dead or something? I mean, come on. That's what I'm looking into. I want to be ready. I'm not going to sit around
Didn't we have a bird flu before?
What's that?
H5N1, we had it before.
But not N5. I'm sorry. H5N1.
Yeah,
bird flu?
We had it before. Yeah.
No, well, that's probably like a different variant, but not this one. This one, the one that I'm reading about, is very, very dangerous.
Right.
So look, all I'm saying is, why are we going to be brain dead and just go into slow? Well, let's just everything will be fine. I mean, just look at the literature. It's telling us, it's giving us the answers. We might want to be ready. Well, at least I'm going to be ready.
Right. So anyway, so it will increase the effects of, again, its fungal infection by improving the solubility, changing the pharmacokinetic, and contribute to the increasing efficacy of antifungal, especially if they are fat soluble or poorly soluble in water. More soluble drug can better absorb, distribute, deliver into the site of infection, This results in higher concentration of the drug in the vicinity of the fungal cells, leading to more effective treatments. And so the use of cyclodextrin enhancing the efficacy of antimicrobial agents holds a promise for development of more effective treatment for fungal infection. And this approach can lead to creation of new formulation that provide better patient outcomes, especially for those suffering from infectious caused by drug-resistant strain, right? Other option is that, if that drug, naked drug, it has to go through a transporter in that fungus, and that transporter is being mutated, then using cyclodextrin will bypass that, because the way it's going to get inside the fungus is going to be by endocytosis, and that will bypass that obstacle and increase or break the resistance of that bacteria or that fungal. Even bacteria can be the same applied here. And depth of analysis, the beta-cyclodextrin in antiviral therapy, efficacy of cyclodextrins. So cyclodextrin also has an antiviral effect, direct antiviral effect, by inhibiting the fusion of the virus with the host. And so beta-cyclodextrin shown uniform effectiveness across the range of cellular modules, and this include primary human pulmonary cells, which are crucial for respiratory virus research, and nasal epithelium of hamsters, an important in vivo model for studying upper respiratory tract infection. And how it works is by inhibiting the fusion, the endocytosis process of the virus with the host. The ability of cyclodextrin to function in different cellular environment underscore their versatility, and as potential therapeutic agent, it suggests that their antiviral properties are not limited to specific cellular species, enhancing their applicability in real-world clinical setting, because it works in general. It's not specific like for spike protein only. Any envelope virus, it will intercept or prevent its fusion endocytosis by the host by interrupting that process. So the mechanism of action, by disruption of viral fusion, the primary mode of action of beta-cyclodextrin appear to be interfering with viral fusion process. By integrating into cellular membrane, the beta-cyclodextrin can alter the lipid composition, especially the targeting cholesterol and sphingomyelin molecule, and prevent that fusion from happening. Alteration membrane composition, cholesterol and sphingomyelin are critical components of cellular membrane that virus exploit for entry into and replication. Beta-cyclodextrin ability to modulate this lipid disrupt the membrane organization, hindering the virus from life cycle. So it prevents the fusion and endocytosis and the virus from getting inside the host cells. That's what the cyclodextrin, so in general, works for any virus. And that's why it has a potential broad spectrum application, giving the membrane fusion as a common steps for many viruses. The mechanism by which beta-cyclodextrin operates suggests a potential for broad spectrum antiviral activity, whether it is corona or H1N1 or whatever it is, any envelope virus or Epstein-Barr virus or herpes virus, anything that has envelope, this will help. This could make beta-cyclodextrin valuable against a variety of viral pathogens beyond coronaviruses. And so there is a promising rule of cyclodextrin as antiviral agents, that they demonstrate efficacy in multiple cellular models, and their unique mechanism of actions and target fundamental steps in viral infection make them a compelling candidate for further research and development in the field of antiviral therapy. The other thing about the cyclodextrin, it can be a drug formulation potential. Cyclodextrin compatibility with oral, nasal, nebulized solutions is just potential for diverse safety drugs, right? And so we can diverse safe drug. We can use it as a delivery for any drug. We can use it for oral application, nasal application, ophthalmic application. That's a good thing, right? It enhanced absorption through the eye, through the nose, through the air, and it protected from the gastric enzyme degradation and from the pancreatic degradation, and gets it into the body. Plus, it protects from the blood enzyme degradation as well. And also, it does have very good in reducing infection, supports clinical testing as prophylactically compound. It's a good thing as in preventing of infection, because if it inhibits the virus from attacking the cells, that's a good thing as protection as well. So if you take cyclodextrin, you can use it as a prevention, not just for treatment as well, right? And so when the virus is attacking the body, the cyclodextrin will combine with them, preventing it from integrating or fusing with the host cells. And the safety profile is very well established for beta-cyclodextrin, making them ideal for developing affordable prophylactic agents against coronavirus. So you can take it before getting infection with coronavirus, right? So I'll load it with vitamin D, okay, and I'll take it orally or spray it intranasal, or to use progesterone, they will call it cyclodextrin, and cyclodextrin will help me to protect me from all the virus, including corona. So I think it's a good thing. Or I use with methylene blue. I'd use it intranasal, and I can help to protect me from. It's like a prevention, right? It has a rule similar to vaccine, right? For vaccine, prime your immune system against the virus. This is protecting your host cells from being fused with the virus. So the ease deployment.
I was going to say at the same time, if you're loading it with methylene blue or
Right.
even cytosine or both, you're also buffering the cytokine storm
Right.
that they talk about with H5N1. And I think with H5N1, it's because it mutates very quickly. That's why this one can so-called jump over to humans and spread very quickly. And it acts very fast. It suppresses the dendritic cells. It causes lymphopenia. It once it starts going, it's setting off a cytokine storm, doing all those things like respiratory depression, even getting down into the lower lung epithelium, the alveolar cells spreading. It's causing red cell lysis, causing death very quickly, a very high rate of death. So, if this is a possibility, it might be a good idea to get familiar with this concept right here, because this to me looks very, very hopeful, and it's something that we can put our fingers on, we can focus on as a strategy that can add with the other strategies and cover the other mechanisms involved with viral infections, particularly the serious ones, buffering the redox, modulating the inflammation, protecting those nicotinic receptors, also preventing the entry of the cell, and maybe even consider something that maybe we'll find something that can trigger apoptosis of virally infected cells. That's another thing I'm looking into, but just want to make this clear.
Right, and also make sure that we have the link that I've been sending it in the chat room for you to get your CME, because this is a CME. And so in the chat room, there is a link for that. And if you don't receive it, just let me know. I'll send it to you so you get your CME for 2 hours, because we spend almost now 2 hours here. Anyway, so I think it's easy deployment. Beta-cyclodextrin can be more accessible in low-income countries than vaccine. That's a good news, due to simpler storage and administration requirement. So I can just give it to all the Africans because most of them are low-income countries, and help them to protect them from coronavirus and many other viruses. Combination therapy, they're using compound, or I can combine it with antiviral drugs. So I can benefit from the sidal effect of the antiviral drug itself, interfering with the metabolism of the virus, plus interfering with the fusion of the virus to the host by encapsulating the antiviral drug, or encapsulating methylene blue, for example. So the broad spectrum antiviral, the mechanism beta-cyclodextrin could be effective against various respiratory disease, especially the membrane envelope viruses and emerging novel coronavirus treatment. We can use that for coronavirus as well. Clinical development, despite promising results of beta-cyclodextrin, it requires rigorous clinical assessment for further development. And the summary highlights the potential of beta-cyclodextrin as a versatile and accessible antiviral agent, particularly in the context of coronavirus infection. Their broad spectrum activity and established safety profile position them as a promising candidate for future clinical development and global health initiative. So that's a good thing, right? Can we use cyclodextrin to deliver cancer drugs? Yes, because it helps to get those cancer drugs more wrapped around those particles as nano, and get those cancer drugs into the pathology, into the leaky blood vessels versus the tight blood vessels of the healthy tissue. And this will minimize the toxicity of the healthy tissue. So this system can be designated to respond to specific physiological environments, such as the acidic environment of the tumor. Also, we can add things inside this pack of cyclodextrin where it become sensitive to the environment of the tumor and where it will blow up or release the contents. So you can add, for example, magnetic in it, iron inside it, and you just do some magnetic field, and that helps to attract the drug into the cancer area, or even release them as well from the uh, from the uh, from the capsule of this nanoparticle. So we can do a lot of we can add ligands to it, right? The cyclodextrin, you add ligands, and that specifically will target the receptor of the cancer, or anything that will lead to the cyclodextrin respond to the tumor microenvironment and release its content. Again, they use some magnetic irons inside it, and then they irradiate some magnetic field around the cancer to release the content of those nanoparticles inside the cancer. There's many things that we can do and modify, but I like to block them with platelet nanoparticle, because platelets itself has a lot of receptors that target the pathology and target the cancer. Ensuring the sufficiency, reducing toxicity, achieving the efficient delivery to the tumor sites are ongoing challenge, and I think cyclodextrin will be some answer. It will answer some questions and resolve some problems. Moving from laboratory research to clinical application is a critical step requiring rigorous testing and validation, which our group of chronic disease prevention management, we all the time lead that. And if you see here, I know anti-cancer drug, chemotherapy, or genetic therapy, RNA, DNA, or antibodies, all of them, they have poor solubility, they have different toxicity because it goes everywhere, right? It does have, some of them, they have immune issues, response, right? And whether they become allergic to those drugs, or it suppressed the immune system, and so or they have problem with getting into the target because of problem with transmission obstacles. So this cyclodextrin will solve these problems, right? Make it more soluble, stable, more targeting by the nanoparticle, and less immunogenic, and it gets the drug into the targeting in a very intelligent way. And I think you can use many things, though, the cyclodextrin, right? Whether it's a drug, antibodies, DNA, and you can make those cyclodextrin loaded drugs, those nanoparticles, sensitive to pH, where they release when in acidic environments, or you can add some iron magnetic inside it and just put magnetic field, and it will blow up and release those particles inside the drugs inside the cancer. There are many things that you can use to target the cancer with those nanoparticles. I think we're good. If you have any questions, let me know. Are we good? Everybody's happy here? Any questions?
That's
I think that was
very good, very good.
yeah, that was an excellent lecture, and I think that opens up a whole nother possibility for what we can do. And I mean, it just covers so many different things. I think it's very exciting. I like platelet nanoparticles, but sometimes in the context of delivering compounded drugs or compounded peptides or whatever we're sending, it's not possible to do this with platelet-derived nanoparticles. We have something that's safe, that can enhance the efficacy. Perhaps the nasal sprays, if they are water-soluble and having difficulty getting into the brain, maybe this will help better delivery, so we can have better efficacy. And cyclodextrin, to me, that's still very natural. It's just basically a sugar molecule wrapped in a like a donut, kind of. You know what I mean? So it's not like it's a hardcore drug. Is that correct?
Yes, I think it's just basically we entertain it as a delivery mechanism, as a base, packing drugs, getting into the pathology, more efficacy. Again, platelet nanoparticle will add value to the cyclodextrin. After you load in cyclodextrin, you can clock them with platelet nanoparticle, especially for anti-cancer drug, or if you're doing joints and you want to benefit from the platelets growth factors as well. I will load it with platelet nanoparticle, but some other application where the compounding pharmacy themselves, they can do it. You get it ready, loaded with cyclodextrin. You don't even need to do it in your clinic, because this is something feasible for the compounding pharmacy to load drugs into cyclodextrin. Requires some technical training, which we can provide, and you can get it ready as intranasal eye drops from the compounding pharmacy directly to your clinic. So there's many things that we can do with cyclodextrin. And
Is
all the
pure
stuff.
cyclodextrin is available?
Yes, it's available. There is some companies, regardless of their names, but they have better versions, and I'm investigating and seeing what we can do. But outside the CME, we can talk about it more. Let me go ahead and stop the recording, because do you have any questions before we stop the recording? Everybody's happy?
Do you think oxytocin nasal spray might have better